Good afternoon. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, here to give you an update on COVID-19 in Chicago. We will start with our travel advisory, our travel order. We are removing Arizona and North Carolina from the list of states, and we are adding South Dakota. As a reminder, if people travel to or from these states upon their return to Chicago, they need to quarantine for 14 days. You'll see on this map here, the states in red are now the states where the quarantine is in effect. We have one state that is now on the buffer list. So Kansas is at its first week of having fewer than 15 cases per 100,000. If next week they again are below that 15 case per 100,000 per day mark, they will be removed. So you'll remember last week Arizona and North Carolina were on the buffer list. They successfully continued their progress and are now off the list. I do want to talk about Illinois. You'll see on the map here, the states in red are, again, the states that are under our quarantine order. The states in yellow are kind of on the watch list. They're in that 10 to 15 cases per 100,000 per day mark. Illinois does not have a color on it because Illinois has now passed the more than 15 cases per day per 100,000 population mark. The city of Chicago has decided not to institute any travel restrictions within Illinois. Our focus will remain on education and awareness, but certainly this is concerning, where we've continued to see increases of COVID cases here in Chicago and across Illinois. Chicago is at 12.6 cases daily per 100,000, and Illinois is at 15.9 right now, cases per day per 100,000. We are not imposing any travel restrictions, but we do want to highlight that if people are traveling within Illinois, it's important that you pay special attention to the things that we already know work. Wearing the mask, extra hand washing and sanitizing, maintaining the social distancing, and if there's not need to travel, the recommendation would be not to travel. Finally, as a reminder, if anyone is ill, it is the law that you stay home, not go out, and especially not travel. I do want to highlight within Illinois, the Illinois Department of Public Health every Friday has been noting warning counties, and you can go to the Illinois Department of Public Health website to see more about this. There were 20 counties that were placed on the list last Friday, and I want to make sure people understand what these warning counties mean. It means that there are 2 points of concern. One, for example, would be the level of new cases that we're seeing, and to be frank, virtually the whole state is now at a point where we are seeing a level of new cases that is of concern. A county goes on the warning county list if there is something else that is of concern. A higher percent positivity, concerns about decreases in hospital availability, worries about increases in death, things like that. And so every week there are counties that are being updated as warning counties, and I encourage you to watch for those. In addition, there are 2 areas in the state which are known as Region 7 and Region 4 that have had some restrictions that have been put in place because of particular concerns for COVID. And again, that's really a decision that's being made by the Illinois Department of Public Health, but we're getting some questions. So Will and Kankakee counties in the south suburbs closer to Chicago will have some restrictions in place starting tomorrow. And then Region 4 down in East St. Louis, also there are some restrictions in place, and those may be tightened further over the next week. And those are because in both of those regions, in addition to having the relatively high caseload, also, we've seen that percent positivity over 8% for multiple days. And that percent positivity over 8%, you know, is just one of the things that we follow here in Chicago and around the state, but it just suggests that there are a lot of cases of COVID and there's particular concern. And so I would encourage people just generally right now across all of Illinois, including in Chicago, we need people to really have their guard up. to be wearing the face covering, keeping the social distance, not getting together unnecessarily, not having larger gatherings, because right now we are concerned, and even more concerned than we have been, about the state of COVID in Illinois. Here is what our case numbers are looking like here in Chicago. So as always, you can go to chicago.gov/coronavirus, and right up at the top, you can go to latest data and find everything you want to know about cases, hospitalizations, deaths, our reopening statistics. So you can see on the graph here, this is really highlighting that black line is the 7-day average. And you can see that back at our peak in May, we were seeing on average more than 1,000 new cases of COVID every day in Chicago. And we had a few days that were close to 1,500 cases per day. As of today, we are adding 341 new cases each day in Chicago as that 7-day average. That's concerning. We want this number to get back under 200 cases per day. When we can get back under 200 cases per day, that knocks us back out of the high incident state. And I'll remind you that when we saw that number come up over 200 cases, that's actually when here in Chicago we instituted a number of stricter restrictions. That's when we closed the indoor bars. That's when we limited the number of people who could sit at restaurant tables, for example, to 6, down from 10. We put some other restrictions in place. And we've really noted that 400 new cases per day would be a point of significant concern for us. That note of that cases of 341 per day is a 7% increase from last week. So it is on the way up. Where we look at our test numbers and our percent positivity numbers, our testing numbers are also up in Chicago. So we are now performing an average of 8,157 tests per day. That's really high, the highest that we've seen. That alone is a 6% increase from last week. And so I've had people say, isn't that increase in cases just because you're doing more testing? I want to be clear that it is not just that we are doing more testing, because our test positivity remains high. It's at 5.1% today, as compared to 5.0% 1 week ago. So it's been relatively stable, but if that increase in cases were just being driven by an increase in tests, we would see that test positivity coming down as opposed to going up. So unfortunately, it is not all just being driven by increased testing, and we really need to emphasize that right now, while cases are on the increase, anybody with possible COVID symptoms. Maybe you just feel like you have a cold. Maybe you just feel like you're under the weather. We need you to get tested for COVID, because you knowing whether or not you have COVID helps you be even more careful with the other people in your life and helps us really prevent the spread. I do want to highlight that at this point, we have not seen an impact on either hospitalizations or deaths here in Chicago. That's very good news. Most of our cases continue to be among younger Chicagoans. We're seeing the largest percentage in that 18 to 29-year-old group, and then followed by the 30 to 39. We have seen some increase in 40 to 49-year-olds here in Chicago, so that's another group that we're keeping an eye on. But as compared to earlier on in our outbreak, where we were very disproportionately seeing cases among people in their 70s and 80s, at this point it has been more still in younger Chicagoans. And that's good news, because younger Chicagoans, by and large, are less likely to have the underlying conditions or less likely to be hospitalized or to die. Although I want to be clear that it does happen, and we do see young Chicagoans getting seriously ill and hospitalized. But some of the reason we've not seen the major impact on hospitalizations or deaths is, I think, that different demographic pattern. Hospitalizations here in Chicago, this is just among Chicago residents. At the peak, we were seeing more than 150 people getting admitted every day here. And at this point, as of today, we're at 13 Chicago residents getting admitted per day. And that has been stable, under 20 per day on average, going back for a couple of months now. So we're keeping a close eye on that. Deaths, similarly, among Chicago residents, we were close to 50 Chicago residents dying every day at the peak. And right now we're at 3 Chicago residents on average dying every day. That has been stable at 2 to 3 residents, also going back over a month or two. So both of those remain, of course, higher than we would like to see them, but we've not seen any impact at this point on our hospital system. That would be one of the things that we would be watching very closely and would be thinking about putting further restrictions in place if we were to see that. I also want to highlight this hotspot analysis, which you can find on the website. We're running this week after week to really see geographically where in Chicago are we seeing more cases than might be expected based on population and fewer cases than might be expected based on population. And you can see that still very much we are disproportionately seeing cases in Northwest Chicago and in Southwest Chicago. We also continue to see a lot of cases among Latinx Chicagoans. Nearly half of our new cases at this point are among people who report that they are Latinx in ethnicity. We are seeing fewer cases and broadly better control both on the north side and broadly on the south side. But I want to be very clear that we continue to see cases coming out of every zip code in Chicago. On the southeast side, that's been an area that we've been making some progress in. It had been a significant hotspot, and we're seeing some good progress there, but we really are continuing to push testing resources, education resources, community outreach resources to the areas of significant concern. I do want to highlight, in addition, just a few stories from our case investigators. We've heard that sometimes it's hard to really think about what's happening just from the statistics. And so pulled some of the data just from the last week or so that our case investigators. As a reminder, every single person diagnosed with COVID who is a Chicago resident gets a case investigation and gets contact tracing. We continue to hear travel as a significant theme. People returning from Wisconsin and Texas and Puerto Rico and Mexico, bringing back COVID. We also very, very strongly continue to hear about family gatherings and informal gatherings as being a major source of spread. We hear stories about a 17-year-old and a grandfather who both attended an out-of-state wedding where there were 90 to 100 people, some mask wearing, but not consistently, and significant spread within that wedding. We continue to hear about birthday parties and funerals. We hear about people playing basketball together in the pool or soccer together in the park. We hear about spread between boyfriends and girlfriends. We hear about family barbecues in the backyard. We hear about people sharing e-cigarettes or sharing drinks, and teenagers just hanging out with their friends. Again, these are not the kinds of stories that typically make headlines, but they are very overwhelmingly how we are seeing COVID spread in Chicago. We're hearing stories like dad thought he was sick from overworking and had a mild cold. Only when the son spiked the fever did both test positive. We're hearing about people who are concerned for potential COVID, get a COVID test, but then don't wait for the results. And I really want to emphasize that if someone is having symptoms for COVID or they've had a serious exposure to COVID, it is crucial that you wait for that test result and consider it positive until proven otherwise. So if you've gotten a test, even if you think you've had a mild cold or you're just overworked, you must stay home and you must try to limit contact even within the household. That could mean wearing masks at home while you're waiting for some of those test results, especially if you've got someone who's older or is more vulnerable. I also want to emphasize that we continue to see relatively few cases in those congregate settings and workplaces like we did early on. Early on, we saw a lot of cases in our long-term care facilities and our nursing homes. We saw a lot of cases in homeless shelters. We saw cases in group homes, and we saw cases in large workplaces. Right now, that is not really the story of COVID by and large. We've learned a lot about how to protect people, I think, both in these congregate living settings and in workplaces. We continue to have a team that works whenever we think that there's the potential for spread in a workplace, and we do investigations. We continue to see cases, certainly, in long-term care facilities and in nursing homes. We have a team that's also working on that. But we're not seeing major spread in these settings, and instead it's more in the family settings. I also just want to send a particular message because we still are getting messages from people who think that COVID is not real, or that it's a hoax, or that it's no worse than the flu. And I want to share a story from one of our investigators just in the last week or two, one of our pediatric case investigators who had called to follow up with the mother's phone number for one of our diagnosed pediatric COVID cases, and called and did not get the mother, got the aunt of this case, who actually said, the mother passed away yesterday. The mother was only in the hospital for 3 days before she died. And I have become the legal guardian for this child as of yesterday. The mother had been well enough to make the appointment for her child to get that COVID test. And our investigator really was just bringing out that time after time again, our investigators and our contact tracers are being dropped into the middle of these family and community traumas that are playing out over and over again across Chicago. It is unusual to have mothers of younger children die, but it happens. And even if it's not a younger person, if it's a grandmother, a grandfather, an aunt, an uncle, over and over again, we are hearing about people, even now in Chicago, who are seriously ill, or in some cases who are dying, and our hearts go out to those families. If you still think COVID is a hoax, if you still think COVID can't affect your family, I would ask you to put yourself in the shoes of the people who are working so hard every day at the Chicago Department of Public Health, calling and hearing these stories. We want to be able to turn this around, to see our cases head back down, and to not have to be hearing stories like this anymore in Chicago. I do also want to highlight just recommendations again for reminders for being able to limit that household spread. So first of all, as a reminder, if someone is sick, you must stay home, except to get medical care. You need to stay away from others as much as possible. And in a household, that means isolating in a separate room if you can. If you can sleep in a separate bedroom, if you can use a separate bathroom, that's better. If you can't, and we know that there are plenty of households that don't have separate bedrooms, don't have separate bathrooms, it's especially important that you're doing extra cleaning of any high-touch surfaces. We want folks wearing masks, even within the home, if someone has been diagnosed with COVID, especially if there's someone who is higher risk. If someone is sick, they should not help prepare food. They should try to eat separately from the family. And if you don't have a separate bedroom, try to have the person at least sleep separately within the room or within a separate room, because we know that sharing a bedroom in particular is high risk for the spread of COVID. Similarly, if we think about the other people who are within a household, if there has been someone diagnosed with COVID in your household, your whole household is going to be recommended to quarantine for that 14 days. A negative test does not get you out of quarantine if someone has been diagnosed and you've been that close household contact. And you should really choose one or two family members who are at lower risk if they need to be going out to run errands, if you can't have someone bringing food and other things in. When the case investigators and contact tracers reach out to your family, they will help. They will help figure out what resources you may need, if there is food support, if there is other things that you're needing, childcare, isolation, quarantine, to help make sure that your family is getting the resources that are needed. You want to be able to teach children to be washing hands, and as much as possible, even again, if someone is sick, young children can also be taught to wear masks. And those everyday preventive measures do work. We know at this point what can help prevent COVID. It's just about making sure that we keep it in our minds. Everybody wants COVID to be over, but unfortunately it's going to be with us really for a long time to come. The last thing I want to note is really a positive note, which is that yesterday, the University of Illinois Chicago launched the first vaccine trial here in Chicago. As people may be aware, there are multiple vaccine candidates that are entering what are called phase 3 trials here in the US. And in a phase 3 trial, that's when there's already been quite a bit of safety testing, and there's been some testing in a small number of people that show that the vaccine looks to be effective. The phase 3 trial is when you trial the vaccine in thousands of people across the US or across the world. And you trial it in people of all different ages and different backgrounds. And at the most fundamental level, you basically give half the people in the trial the vaccine, and half the people in the trial what's called a placebo or a dummy vaccine. And it's double blinded, which means the person does not actually know whether they've received the true vaccine, and neither does the person who's giving the vaccine. And then what happens is we follow forward all of the people in these phase 3 trials, and we follow them forward for months or probably even a couple of years. And we look to see, first of all, make sure if there is any concern for side effects that didn't come out in those smaller trials. You want to be absolutely sure before a vaccine is approved that that safety profile is very good. You also, though, want to make sure that the vaccine is effective. And so we follow people until a certain number of people who are in these trials have gotten COVID. And then you unblind the trial and you do a comparison. And hopefully, if this vaccine has worked well, almost all of the people who have gotten COVID would be in that dummy vaccine side or the placebo side. And the people who do not get COVID have been on the side that got the true vaccine. This kind of double-blind randomized trial is our gold standard for testing vaccines, for testing new drugs here in the US. And these trials are the way that we will know that a vaccine is safe and effective when it is approved. So it's exciting that the first people, the first 2 folks, were given the dose yesterday here in Chicago. And University of Illinois at Chicago will be enrolling up to 1,000 people here in Chicago, and that's part of about 30,000 people that will be enrolled across the U.S. They and all of us would like to encourage people to volunteer for these trials if you're interested. We're especially interested in making sure that these trials reflect Chicago. So we would like to encourage people who are over 65, who would be higher risk of severe outcomes, to think about potentially participating in the trial. We'd like to encourage people with pre-existing health conditions. We'd like to encourage people who live in multi-generational homes or are healthcare workers, may have other risk factors. And we'd like to encourage people who are living in communities that are experiencing disparities. At this point, most volunteers for these trials have been white. And that is true for the volunteers for most trials generally. And, in a lot of ways, that's not a surprise to me. Where you look at the history of what some of the trials have looked like, historically here in the US and around the world. But there are a lot of safety precautions that are in place. There are a lot of informed consent procedures that are in place. And University of Illinois at Chicago was really chosen because they are a place that is known to do safe vaccine trials. So it is always a choice if you want to enroll in a trial. If you're interested, you can go to coronaviruspreventionnetwork.org. This is the national website set up for anybody who's interested in participating in vaccine trials. You can put in your information, and University of Illinois at Chicago may reach out if you're fitting their criteria. Northwestern University is also enrolling. They'll be doing a trial for a different vaccine, probably starting in early September. But this is a good way if you're potentially interested. Signing up only means that you will get more information and if you decide to participate. But regardless, it's exciting that we are talking about phase 3 vaccine trials, because that means that we are making real progress toward a safe and effective vaccine. I remain optimistic that we will have a vaccine likely approved, I would guess, very near the end of this year versus the beginning of 2021. I do expect that it will take a year probably for that to roll out entirely across Chicago. My expectation is probably children, for example, will not be in those early stages of who has had the full safety and efficacy testing. They'll probably be in some later stages of rolling out the vaccine. But the fact that we're talking seriously about a vaccine with all of the safety precautions in place, and that the important testing is going on now so that we'll have full confidence in a vaccine that's available is really important. I will be absolutely at the front of the line when a vaccine is available, and we will continue to keep you up to date on COVID vaccine progress. In the meantime, I'd like to remind everybody that we are heading into flu vaccine time. You can go to chicagoflushots.org if you want to see places in Chicago where you can get a flu shot. Pharmacies are starting to have them available. Your providers, your physicians and pediatricians are starting to have flu shots available. The Chicago Department of Public Health will be having some free vaccine clinics available. A reminder, virtually everybody, with a few exceptions, over the age of 6 months should get a flu vaccine every year. And this year, that is especially important because preventing influenza means that fewer people will need to seek medical care and testing for possible COVID-19 or influenza. Remember, the way these present, fever, shortness of breath, not feeling well, can be very similar. And where we're already concerned about testing resources and hospital resources, the fewer people we can have with possible flu, the better for everybody. Also, increasing flu vaccination uptake helps us save healthcare resources for COVID-19 and other conditions. Every winter here in Chicago, we see a surge of hospitalizations related to influenza. And we see that different from COVID in younger people as well as older people. So every year we have young people who are hospitalized, and unfortunately we usually have a couple of children who die every year from influenza here in Chicago. The reason a new vaccine is made every year is that the flu vaccine is remade based on the strains that are circulating in the Southern Hemisphere. And at this point, the Southern Hemisphere has actually looked quite good from a flu outbreak perspective because a lot of the precautions that have been in place for COVID, things like wearing masks and hand washing and keeping your distance, will also be somewhat protective against influenza. But that flu vaccine is what helps keep you out of the hospital if you get influenza. It does not completely protect against flu. It's not 100% protective, but it is so important in terms of helping limit those serious impacts. So especially if you have underlying conditions, if you're someone at risk of getting COVID complications, for goodness sake, please get a flu vaccine. We don't know what it will look like to have someone co-infected with influenza and COVID-19 at the same time, but we know it would not be good. So please start reaching out. It's a good time to be reaching out to your doctor, getting your health into good shape. We're concerned, frankly, heading into fall and winter about what health is going to look like in Chicago. I'm concerned about the increases that we're seeing in COVID-19 here in Chicago and around Illinois. I'm concerned that as the weather gets cooler and we start doing more indoor activities, we have the potential to see some more spread. And I'm particularly concerned where we think about influenza on top of COVID-19. So now is the time to start reaching out and getting that annual flu shot, doing everything you can to get your chronic conditions under as good control as you can, and keep doing the things that we know work. I've been very proud of Chicago's response. By and large, we see people wearing masks, taking this seriously. We've seen our businesses do a really good job, and we have stricter restrictions in place, even that are required at the state level. But now is the time to double down on those things that we know work. I would love to see us turn this around, to get those case numbers down, even back under 200 new cases per day if we could. Being in as good a position as we can as we head into cooler weather is going to be crucial to our long-term efforts this winter. So thanks very much, and I'm happy to take questions.
Thank you, Dr. Arwady. Recently, the CDC updated its travel requirements. And while it still does recommend to follow social distancing and other types of rules, it is no longer requiring a 14-day quarantine when you visit one of those states. Could you react to that?
Yeah, sure. So one thing is that, unfortunately, the United States is having a significantly worse outbreak than nearly any other country in the world. There are some other countries, Brazil and India, that are also having some large outbreaks, but in a lot of ways, you know, as people probably know, the reason why U.S. citizens right now can only travel to very few places around the world is because our COVID numbers, frankly, are worse than those abroad. And I feel like that may have been in some ways a response to that. What I would say is that we don't have a lot of people traveling internationally, but we are seeing cases in people, like I said, returning from some of the places that travel is still allowed. So we are seeing cases right here in Chicago in the last week from people who have traveled to Puerto Rico, to Mexico, et cetera. And we will follow the state's guidance on this. Generally, we would not do a separate sort of international level, and what the CDC has really said is that they would defer to state or local jurisdictions. I believe we will probably continue to have a 14-day recommendation in place. As you know, at the state level, it's been more of a travel advisory, but I would defer to the Illinois Department of Public Health as far as the recommendations. In a practical level, I think my recommendation would be that if people are traveling, that they would, ideally be abiding by that 14-day quarantine that has been recommended, but we will not have an order or a requirement in place, and we would not enforce around that.
But the state, as you mentioned, does not, it's the city that has this rule. Yes. The state has not put anything in place. And if we were going to follow the rule, because of what you've said today, yeah, you'd really tell everybody, don't go anywhere in the state.
Yeah. So as I said, we made a decision not to impose travel restrictions within Illinois. Just as, we thought about, for example, when Wisconsin was on the list, when they were really having some problems, we looked really closely at should we instead try to only do some counties in Wisconsin, recognizing that there were parts of Wisconsin that were in relatively good shape. But we felt that for consistency and frankly to try to decrease the potential for confusion, that it didn't make sense to do a county by county restriction. Within Illinois, we know that we have people who are commuters. We know that we have people who travel, and realistically, we didn't feel that it made sense to try to enforce any sort of quarantine restriction within Illinois. And frankly, when Illinois is having a problem, we're all having a problem. And so I think what we want to really emphasize is that right now, it is true that Chicago is doing a little bit better than some other parts of Illinois, but none of us in Illinois are really in a place to brag at the moment. Places that we have the quarantine order in place for states are places that are broadly even more out of control than Illinois, right? Illinois is right at that sort of 15-point-something mark, and we still are seeing states that it is significantly higher. So we didn't want to take off the existing travel restrictions to other states, but we didn't feel realistically that we were in a place to put quarantine orders. My message really at the end of the day is that if people can avoid unnecessary gatherings really of any kind, it's a good time to be doing that, right? In Chicago, in the state, it's a good time to be limiting travel to places that are of concern. And so, in Chicago, I really I'm not going to be imposing sort of on my I talk regularly to the other local health departments. Everybody is working hard in terms of trying to get this under control. And frankly, some of the requirements that are going in place in some of the places that have had higher concern, a lot of them are actually restrictions that we already have in place here in Chicago that we've proactively put in place. And so we're, pleased to see people taking this seriously, as I think they are broadly across the state. And the hope is that we will turn this around.
Can we get your thoughts on today? Governor Pritzker reinforced the idea that restaurant customers should be wearing the mask basically at all times other than eating.
Yeah. So obviously, I am in favor of that. We've been explicit about requiring masks, obviously, in indoor settings. That's been a long-standing thing, and that making sure people are wearing masks when they're entering the restaurant. And previously, it had been a requirement that you needed to wear it while they were seated. And now with this in place, it's really reminding people that when you are dining with people without your mask on, those people have entered your bubble, basically, like it or not. If you're sitting within 6 feet of them and you don't have that mask on, there is the potential for spread. It's one of the reasons here in Chicago, once we got over 200 cases, we had dropped that number of people who can sit at a table from 10 back down to 6. And I think where we think about protecting the workers in the restaurants, it is appropriate to be sort of putting that mask on when you are interacting with your server. So I am very much in favor with it. Again, if people are going to restaurants, have that mask, have the mask on when you're interacting with the server, take it off just when you're eating, and then put it back on. And I think, it's a sort of common sense recommendation that if people are just doing what they can to think about how can I limit the potential that even though I feel just fine right now, I could still have COVID because I could be asymptomatic. And I want to be fair to people who are working and people who are out and people who have not chosen to come into my bubble. So I'm very much in support of it.
In New York City, the mayor there is recommending that classes be held outside as much as possible. They are considering closing streets, using parks, using parking lots, maybe setting up tents. Is that a good idea?
So we know that the risk of spread outdoors broadly is less than the risk of spread indoors. That said, we do see spread outdoors, so I don't want people to think that just because they're out of doors, they don't need to keep the 6-foot distance, wear the mask, et cetera. I think people are being very creative around trying to think about ways to limit risk. We've seen that here in Chicago, I'd say, around the expansion of the outdoor dining, closing some of the streets in terms of allowing more restaurants to have spaces outside. We've seen churches and others move to outdoor services. And frankly, I think while the weather supports that in places like New York and Chicago, it makes sense to think about creative ways to potentially limit the spread of COVID. I think when we were really working with Chicago Public Schools, and we've obviously continued to work with CPS as we think about what things look like going forward, CPS had already looked a lot at its ventilation plans indoors, and I think those are also really important. So as people are planning or thinking about having out-of-doors opportunities, I think that's in conjunction with thinking about really making sure that ventilation is part of the thought as you move into the winter. So I think, we're love seeing creative approaches to thinking about limiting the spread, but I don't want to give the impression that an outdoor setting is completely free of risk.
From Block Club, several questions. During your live stream today, you said Chicago is seeing more COVID and our new cases average is rising. Do you anticipate hitting 8% positivity or 400 new cases soon?
So it's hard to say. I think, as I mentioned, we had about a 7% increase in our cases just from last week. As I showed on that first graph, this has been a gradual incline. And we actually do some work behind the scenes to not just look at what do the numbers look like overall, but how fast is that rate of increase. So in addition to that 400 case mark, which we've just set as a little bit of a line in the sand around the burden of COVID, if we were to see a more rapid increase, that could also be a trigger for us. And then the percent positivity. The fact that we are doing more testing here, frankly, is part of what is helping keep that number down. And it is really, that percent positivity to me is most useful as a way to direct testing. The testing resources that the Chicago Department of Public Health stands up, we look week after week, which neighborhoods are we seeing high percent positivity or increases in cases, and we really work to try to drive additional testing, because parts of the, and that's as true in a city as it is in a state, parts where you're seeing that high positivity lets us know that you need to increase the testing because you're seeing an increase in cases. So I'm concerned. I'm not horrified by the increases, but week after week, I've been up here really saying, we're up again, we're up again, we're up again, we're up again. And even if the rate is a quarter as fast as it was the first time around, you still get to the same place in 4 weeks. And so we are certainly concerned. I'm glad that we put the restrictions in place when we did, just when we got over that 200 cases. I think that's part of what has kept our increase relatively slow. And frankly, I'm watching the hospital numbers really closely. For me, certainly if we got to an 8% positivity, that would be a major concern, and we would put additional restrictions in place, as is being done at other places around the city. But I don't just look at one thing. I look at the number of cases, the percent positivity, how quickly things are increasing, and are we hitting the health system? And we start seeing problems in any of those, that is when we may need to put some additional restrictions in place.
Another question from Block Club. Young people make up the bulk of Chicago's new cases, but some universities and schools are having in-person class.
Yep.
Are you worried about a surge related to college campuses?
Yeah, so certainly we are working very closely with our many colleges and universities, and have been here in the Chicago area. This is such a difficult time for everybody in education, I think, and in a lot of ways, higher education in particular. Places, especially if they have dormitory living or other congregate living, there are some particular risks around that. And I think we've had some very creative and thoughtful approaches here among our colleges and universities, really thinking about testing strategies and quarantine strategies and some of the same pod and restrictions. So it's not an area that I have major concern for that driving our, sort of a major outbreak pushing us out of control here in Chicago, because I'm confident that if we see concern, if we see outbreak, if we're not able to get things in control in school settings and university settings, that they would take the appropriate mitigation procedures all the way up to going back to virtual if that were necessary. So certainly we are keeping a close eye on this. And when we hear about cases, we're working with schools and with universities. And I feel good about the procedures that are in place there to monitor for that. We would expect cases. There's nothing less. It's just whether if we were to see significant spread or outbreaks, that's where we may need to make some different decisions with the universities. And, time will tell what that looks like.
Jet, final question. Do you recommend people wear face masks at all times when outdoors?
So I do. What we absolutely have required is that people wear a face mask out of doors if they can't keep that 6-foot distance. And so if you are by yourself, out in a field somewhere where there are no people around, okay, you can have the face mask off during that time. But I would ask everybody to have the face mask really with them. And if you are even just passing somebody on the sidewalk, just put your face covering on. I think it's, number one, important for limiting spread, although we know that the risk of spread in a very short interaction is small. But I think it also just sends an important social message that says, I take COVID seriously, you take COVID seriously, together we are doing what we can to protect our community. So it is an absolute requirement that people have face coverings on indoors. It is a requirement that people have them on out of doors if they are within 6 feet of others. And I would ask people who are, maybe out, in more distanced ways, to make sure you have the face covering with you. And if you're even coming anywhere near someone else, just put it on. It's the good thing to do, and it helps really send a message, which most people are doing in Chicago, that we're taking this very seriously.
Thank you.
Thank you.